I'm a student nurse practitioner, and today we are going to be doing a head-to-toe assessment on you. All right, so can you verify your name and date of birth for me?
Angela, and my date of birth is August 15, 1983.
All right, great. So I've already washed my hands, so I have these gloves on now. So first, we're just gonna do an inspection of your skin. Can you pull this down? Perfect. All right, so just inspecting the skin. There's no redness, rashes, or lesions noted on the skin. So now I'm just going to palpate. Okay, do you feel any tenderness? No. Okay, great. Skin feels cool and dry, no masses or induration noted. There's no tenderness. Let's check. All right, good skin turgor and skin has good skin color. All right, so now the head. Head is normocephalic, atraumatic, symmetric. Face is also symmetric. No masses or no redness, lesions, or edema noted. So I'm just gonna inspect your scalp now. All right, no lesions or rashes noted on the scalp. Now I'm going to palpate. Do you feel any tenderness?
No.
All right, no tenderness or masses on the scalp. Hair is evenly distributed. It's fine. And I'm going to palpate your temporal artery. Do you feel any tenderness?
No.
All right, and the temporal artery, the pulse is 2+ in strength. So now we're going to do an assessment of your eyes. So we're going to do a vision test first. Do you wear any glasses or contact lenses?
Contact.
All right, perfect. All right, so can you hold this, hold it at arm's length? Can you cover one eye and read this last line?
LTFPH.
All right, can you cover the other one and read the same line backwards?
LTPH.
All right, perfect. So vision is 20/20 bilaterally, and also we just tested cranial nerve 2. So cranial nerve 2 is intact. All right, so now we're going to inspect. Your eyebrows are symmetric. No rashes, lesions noted. Your eyelids are also symmetric. No rashes, lesions, or edema noted. The position of your eyes are symmetric. And now the width of the palpebral fissures are symmetric. I'm going to look at your medial and lateral canthus. They are symmetric. No lesions or redness noted. Now we're going to assess the lacrimal system. So now I'm going to palpate for the lacrimal gland. Do you feel any tenderness here? All right, perfect. And now I'm going to look at your lacrimal sac. No obstruction or drainage noted. So now I am just going to pull down on your lower lid. Can you look up and down, side to side? I'm going to pull up on your upper lid. All right, perfect. The palpebra and bulbar conjunctiva are pink bilaterally. Sclera is white bilaterally. No redness or jaundice noted. The corneas, no opacities are noted, and your irises are well defined. I'm going to take a look at your pupils. All right. Okay, pupils are equal, round, and reactive, and they are 3 centimeters in size. Okay, so now I'm going to do a direct and consensual pupillary light reflex test. So I just want you to look straight ahead. I'm going to shine a light into your eye. Okay. All right, so left eye constricts, so there is direct reaction, and I'm going to shine a light into the same eye. And this time, well, I meant to say left pupil, and this time right pupil constricted, so there was consensual reaction. Okay, so now we're going to test for accommodation and convergence. I just want you to look straight ahead for me. When you see my pen, just look at the pen. So pupils are currently dilated. Can you look at my pen? Pupils have constricted and converged, so normal accommodation test. So now we're going to test visual fields by confrontation. Can you cover one eye? And tell me how many fingers you see I'm holding all together.
4, 1, 2, 4, 2.
Okay, perfect. So normal confrontation test. And now we're going to test for extraocular movement. So I just want you to keep your head still. You're gonna follow my pen with just your eyes only. Okay, extraocular movement intact, no nystagmus notice, and that also just tested cranial nerves 3, 4, and 6. So all of this, so those cranial nerves are intact. All right, so now we're going to take a look at the back of the eye with the ophthalmoscope, and I'm just going to close the light first. Okay, so I am assessing patient's left eye, so I'm going to be using my left eye to look. So I'm just place my head right here. So now I'm just gonna move in, and optic disc is seen. It's orange in color. Retinal vessels are visualized. No AV nicking, no macular lesions, and the optic disc is 0.3. Okay, so now moving on to your nose, we are going to test for the patency of the individual nostrils. So I'm going to hold down one nostril. I want you to take a breath in with the other. Okay, same thing on the other side. Okay, so the patency of the nostrils are good. So now we're going to do a smell test, and we are also testing for cranial nerve 1. Can you close your eyes for me? All right, I'm going to hold down one nostril. I want you to breathe in. Tell me what you smell. Perfect. Keep your eyes closed. We're going to do the other side. All right, great. So cranial nerve 1 is intact. All right, so I'm going to palpate your nose. Do you feel any tenderness? No. Okay, and I'm going to palpate your sinuses. First, the frontal sinuses. Do you feel any tenderness? No. Maxillary sinuses. Do you feel tenderness? No. Okay. So now we're going to look inside of your nose. I am going to tilt the tip of the nose upward. So nasal mucosa is pink and moist, no discharge or polyps noted. Septum is midline. I'm going to look at the other nostril. Okay, nasal mucosa is again, it's pink and moist, no nasal discharge, nasal polyps noted, and septum is midline. Okay. All right, so now we are going to assess the mouth. So the lips are pink and moist. There's no cracks, lesions, or swelling noted. Can you smile for me? All right, dentition is normal. We're taking a look at the gums as well. Gums are pink, no lesions, ulcers, or swelling noted. Can you open your mouth for me? Okay, the buccal mucosa, they are pink, moist, no lesions or ulcers noted. Can you stick your tongue out for me? Tongue is midline, no lesions, ulcers noted. Can you stick your tongue up? All right, under the tongue is pink, no lesions or ulcers noted as well. And can you open your mouth? The soft and hard palates are pink and moist, no lesions or ulcers noted. And can you stick your tongue out and say ah? Ah. All right, tonsils are absent bilaterally, okay? And while we're here, we're going to test for cranial nerves 9, 10, and 12. So for 9, can you stick your tongue out? Can you say ah again for me? Ah. All right, uvula and soft palate, they rise in midline. So now we are going to test cranial nerve 10, which is the gag reflex. Gonna put this down, and I'm gonna put it towards the back of your throat, so you might feel a little discomfort. Can you stick your tongue out? All right, so gag reflex is present. So cranial nerve 10 is intact, and now cranial nerve 12. Can you stick your tongue out for me? Tongue is midline. Can you move it side to side? And can you say light, tight, and dynamite? Light, tight, dynamite. Okay, perfect. So cranial nerve 12 is intact. So now we are going to look at the ear. So first, I'm just assessing the ear. They are the auricles, and the auricles are symmetric, no lesions or nodules noted. Now we're going to test hearing, and this is also testing cranial nerve 8. I should add with the smell test, we tested cranial nerve 1, and that was intact. So cranial nerve 8 hearing, I'm going to stand behind you. Can you cover one ear and tell me what you hear? 1, 2, 3. Okay, can you cover the other? ABC. Okay, perfect. So hearing is intact bilaterally. Now we're going to do the Weber test. So I'm going to put this on top of your head. Tell me where you hear the sound, whether it's one ear or both. Bilateral. Okay, perfect. So sound lateralized to both ears. So this is a normal Weber test. I'm going to put this behind your ear. We'll put it on the mastoid process. Tell me when you hear the sound stop,
Alright.
Stop. All right. Tell me when you hear it stop.
Alright.
Okay. So air conduction is greater than bone conduction. So this is a normal Rhine test, and with these three tests, cranial nerve 8 is intact. All right. So now we're going to palpate first the mastoid process. Do you feel any tenderness? All right. First the palpate the tragus. Do you feel any tenderness? All right. So now we're going to look inside of the ear. So to look inside, we're going to pull the auricle up and back. All right, so the ear canal, there's no cerumen, drainage, redness, masses, or lesions noted. Tympanic membrane is seen. It's pearly gray, no scarring or perforation noted. Cone of light is at the 7 o'clock position. Handle of malleus and pars placida are seen. The right ear, again, we're pulling auricle up and back. Okay, so the ear canal, again, no cerumen, no drainage, no redness, masses or lesions noted. Tympanic membrane is pearly green, no scarring or perforation seen. Cone of light is at the 5 o'clock position. Pars placida and the handle of malleus are seen. All right, so now we are going to assess your neck. So just looking at the neck is symmetric, and no mass is seen. Pulsation is symmetric. We are going to palpate your lymph nodes. Tell me if you feel any tenderness anywhere. So the preauricular, postauricular, occipital, tonsillar, submandibular, submental, the cervical anterior chain, the posterior cervical, the deep cervical, and then the supraclavicular. Any tenderness anywhere? Okay, so now we're going to palpate the trachea. So using one finger, we're palpating. Trachea is midline, no deviation, no masses noted, and we're going to assess or palpate the thyroid gland. So lift the neck up a little bit. So this would be under the cricoid gland. So the trachea, the thyroid isthmus is midline. No nodules or masses felt on the thyroid gland. Do you feel any tenderness?
No.
Okay. Perfect. All right. So can you swing over this way? Now we're going to assess the cervical spine. Okay. So turn it up for me. All right. So the cervical spine, the curvature is normal. It curves anteriorly. Just pull this down. The shoulders are symmetric, and I'm going to palpate. Do you feel any tenderness? Okay. All right. Perfect. You can swing back this way. All right. Now we're going to assess the chest. So I'm going to need you to put this down. So assessing the anterior chest first. So AP to lateral diameter is 1 to 2. All right. So inspecting the chest, there's no redness, rashes, lesions noted. Rate and rhythm of respiration is normal. Now we're going to palpate. Do you feel any tenderness? No. All right, no tenderness and masses felt. We're going to check chest expansion. Can you breathe in and out for me? All right, chest expansion is symmetric. So now we are going to palpate. Okay, all sounds are resonant, and now we are going to auscultate. Okay. Can you breathe in and out for me? Okay. All lung sounds are clear bilaterally, so now we're going to check the posterior chest. So can you swing over for me? Okay. All right, so now we are going to palpate again. Do you feel any tenderness?
No.
Okay. No tenderness or masses felt, and we are going to percuss again. found our resonant. Now we're going to percuss to find the diaphragmatic excursion. So I want you to take a breath in and hold it. And this is where we are hearing dullness, so you can breathe out for me. And then I want you to breathe in and out and then hold on exhalation. And this is where we hear dullness again. So the diaphragmatic excursion is 4 centimeters, which is normal. Okay, so now we are going to auscultate. Can you breathe in for me? Okay, and all lung fields are clear bilaterally. So now we're going to test for tactile fremitus. So every time you feel my hands, can you say 99?
99, 99, 99, 99.
Okay, so the 99 vibrations felt, but the 99 is muffled. So this indicates no consolidation, which is normal. So now we're going to do the whispered pectoriliquy exam. Every time you feel my stethoscope, can you say 1, 2, 3? Okay, so 1, 2, 3 is muffled and faint, and this indicates no consolidation as well. And now we are going to test for egophony. So every time you feel my stethoscope, can you say E? Okay, so the E was heard, not A, and so that also indicates no consolidation. All right, so can you swing back over this way for me to the front? So now we're going to do your cardiac exam. So first we're going to take a blood pressure. Okay, so in taking this blood pressure, I am first going to inflate, and then I'm going to slowly deflate. And while deflating, the first sound I hear is going to be the systolic blood pressure, and then when the sound disappears, that will give us the diastolic blood pressure. Okay, so blood pressure is 120/70. Okay, so now we're going to, I'm going to take your pulse. So we'll measure for 15 seconds. Okay, so the pulse is 70. So we're also going to check for a pulse deficit. So I'm going to take the pulse. I'm going to check your apical pulse. We're going to find that at the left mid-clavicular left side, 5th intercostal. Okay, so the apical pulse is also 70, as was the radial pulse, so there's no pulse deficit. Okay, so now we're going to identify our cardiac landmarks. So first we have the aortic valve that is at the right sternal border, 2nd intercostal. Then we have the pulmonic valve at the left sternal border, 2nd intercostal. At the 4th intercostal, at the left sternal border is the tricuspid valve. And at the 5th intercostal, but 5th intercostal, left midclavicular, we will find the mitral valve. So now I'm going to auscultate all of the landmarks. we will auscultate with the diaphragm and the bell. So first, aortic, pulmonic, tricuspid, and then mitral. And now with the bell, mitral, aortic, pulmonic, and tricuspid. Okay, can you lean forward for me? And we're going to listen to the mitral valve with the patient leaning forward. And then with the bell. Okay, all pulses, the rates and rhythms are normal. Pulses are 2+ in strength. So now I'm gonna have you lay down. All right, the head of bed is elevated at 30 degrees. So I'm gonna have you look away. We're going to look for jugular venous distension, and that is not noted. Now we're going to auscultate the carotid artery. All right, can you hold your breath for 10 seconds? Okay, no fluids heard. And now we're just going to palpate the carotid artery. Okay. And the rate, the pulse strength is 2+. So now we are going to palpate our cardiac landmarks. So first, aortic, pulmonic, tricuspid, and the mitral valve. And no heaves or throws noted. Now we're going to listen to the areas again with the patient laying down. Okay. Aortic, pulmonic, tricuspid, mitral. And that was with the diaphragm. Now we're going to listen with the bell. Mitral, aortic, pulmonic, tricuspid. Okay. Rate and rhythm, normals, pulse is 2+ in strength. Okay, so now we are going to assess the venous system. I'm just gonna take off your sneakers. All right, so we're assessing the upper extremities, lower extremities. Sorry. Okay, perfect. All right, so there's no cyanosis, no clubbing or edema noted. Now we are going to palpate the pulses. So first the brachial, okay, radial pulses, okay, the femoral pulses, okay, the dorsalis pedis pulses, and the posterior tibial pulses. Okay, all pulses are 2+ in strength. Now we're going to listen to arteries for any fluid. So first is the aorta, then the renal arteries bilaterally, then the iliac arteries, and then the femoral arteries. Okay, no fluids heard. All right, and now while we're here, we're going to do the abdominal exam. So first, we're just inspecting. The abdomen is flat, symmetric, no scars, lesions, or masses noted, no aortic pulsation seen. Now we're going to auscultate the bowel sounds. We are going to start at the right lower quadrant. Okay, there's normal active bowel sounds in each quadrant. So now we are going to percuss. Okay, all sounds are tympanic. So now we're going to assess for the spleen and the liver. So first starting, we're going to percuss for the spleen. We're going to start at the anterior axillary line and percuss. now we are going to percuss for the liver span. We're going to start at the nipple line and percuss down until we hear dullness. Okay, so we have identified dullness, and now I'm going to percuss from the right lower quadrant up until I hear dullness. Okay, so I've heard dullness, so the liver span is approximately 6 centimeters, and this is normal. So while here, I'm going to palpate for, well, first we'll do a light palpation. Do you feel any tenderness? Let me know. Okay, no tenderness or masses noted. Now we're going to do deep palpation. Any tenderness? Okay, no tenderness or masses noted. And now I'm going to palpate for the liver. I'm going to place my hand under the patient on the right side. All right, can you take a deep breath for me? Okay, the liver edge is palpated. Now we're going to palpate for the liver. I'm going to place my hand under the patient on her left side. And now I'm going to press down. All right, spleen was not palpable, but this is normal. And so now we're going to assess for the inguinal nodes. Okay, any tenderness? Okay, no masses or nodules felt on the nose, no tenderness. Can you sit up for me? Okay. Now we're going to do the CVA test, and I'm going to place my hand on patient's costovertebral angle, and I'm going to strike. Okay, tell me if you feel any pain. Okay. All right. Okay. Any pain?
No.
Okay. Any pain?
No.
All right, perfect. So can you stand up for me? Now we are assessing the musculoskeletal system. So once your shoes are on, I'm gonna have you just walk about 5 feet up and then come back to me. Okay. All right, you can come back. Okay, so patient's gait is good and steady, posture is erect. So now can you turn around for me? I'm gonna bring this down. Okay, so now we're inspecting the spine. There's no abnormal curvature, no kyphosis or scoliosis noted. The scapulas are symmetric. I am going to palpate. Tell me if you feel any tenderness.
No.
Okay, and now I'm going to palpate the paraspinal muscles. Tell me if you feel any tenderness. Okay, perfect. So now we're going to check range of motion of the spine. Can you bend down, touch your knee? Your feet, your toes. Okay. Can you bend back? All right, perfect. Can you bend at the waist to the side? Okay, the other side. And can you rotate side to side? Okay, perfect. Patient has full range of motion of the spine. Can you have a seat for me? Okay, and we're just going to assess the muscle groups or inspect. All right, muscle groups are symmetric, no abnormal movements noted. Okay, so now we are going to test for range of motion. We're going to do range of motion of all of your joints. So first we're starting at the TMJ, so I'm going to assess. Do you feel any tenderness?
No.
Okay, so there's no tenderness, masses, crepitus, or swelling noted. Can you open and close your mouth? Okay, and can you, excuse me, extend your lower jaw out? All right, and lower jaw side to side. All right, perfect. So now for the shoulder, any tenderness? All right, no tenderness, masses, or crepitus noted. Can you extend or raise your arms overhead? Okay, raise it to the back. Can you put one arm to the other side and then the other side as well? Okay, patient has full range of motion, full range of motion of the shoulders. And so now for the elbows, any tenderness? Okay, no tenderness, masses, swelling or crepitus noted. Can you bend your elbows and extend? Can you extend your arms out, arms up, arms down? All right, can Patient has full range of motion of the elbows. Now for the wrist. Any tenderness? All right, no tenderness, masses, swelling, or crepitus noted. Can you raise your wrist up, down, and around? All right, patient has full range of motion of wrist. Now for your fingers, any tenderness noted? Okay, no tenderness, masses, swelling, crepitus noted. So can you make a fist for me? Extend your fingers. Can you touch each finger to your thumb? All right, perfect. Patient has full range of motion of the fingers. Now, can you lay back for me? All right, we're going to assess range of motion of the hips. So can you bring knee to chest, this leg? Okay, now the other leg. Okay, so now I am going to move your legs. So first we are abducting. This is adducting. Can you bring your legs to a 90-degree angle? So we're gonna turn, internal rotation, external rotation. So now we're gonna go on the other side. All right, so abduction, adduction, all right, internal rotation, external rotation. All right, patient has full range of motion of hips. So now for the knees, can you actually sit up for me? Okay, can you just extend your knees out in? Perfect. Any tenderness? All right, so no tenderness, swelling, crepitus noted. Now the ankles, any tenderness? No. All right, no tenderness, swelling, crepitus noted. Can you rotate your ankles for me? All right, patient has full range of motion of the ankles. And now the feet, any tenderness? No. Okay. No tenderness, swelling, masses, crepitus noted. Can you flex your feet, point them? Can you bring your heels together? All right, and toes together. All right, perfect. Patient has full range of motion of the feet. So now I'm going to assess for mental status. Just gonna ask you a couple of questions. Verify your name and date of birth for me again.
Angela, date of birth is August 15, 1983.
All right, perfect. Do you know where you are right now?
At school.
Okay, what school is that?
LIU.
Okay, perfect. And do you know today's date?
Today's date is July 27th, 2023.
All right, perfect. So patients alert and oriented ×3. That is to person, place, and time. Okay, do you remember what you did for your birthday last year?
I stayed home.
Okay. What did you have for breakfast this morning?
I had a banana.
Okay, so remote and recent memory are intact. And lastly, can you spell the word tree for me?
TREE.
Okay, perfect. So mental status is intact and patient speech is clear and fluent. I'm just gonna go ahead and test for cranial nerve 7 right now. So just do me a favor, can you raise your eyebrows up and down? Okay, can you close your eyes very tightly? I'm gonna try to open. Close them tight. Okay. Okay. Can you puff out your cheeks? Okay. Can you smile? Frown? And show your teeth? Okay. So cranial nerve 7 is intact. All right. So now we are going to assess the motor system. So first, can you stand? You can just stand right here. Okay. Can you extend your arms out? We are testing for palms up, pronator drift. So close your eyes. And we're going to observe for a few seconds. Okay, there's no unilateral drifting, so pronator drift test is negative, which is normal. So you can have a seat. Okay, so now we're going to assess the muscle strength, the various muscles. So first we're going to start at the neck. Wherever you feel my hand, I want you to push against it, okay? So first at the neck. All right, perfect. The other side. All right, perfect. Now of the shoulders, and while here, we're actually going to test for cranial nerve 11. I'm going to put my hands on your shoulders. Can you shrug? All right, perfect. Cranial nerve 11 is intact. So can you bring your arms up? All right. Push against my arm, my hand. All right, perfect. So now of the elbow, like this. So push against my arm, my hand. All right. That's it. Okay. On this side. All right. So push against. Okay. All right. Perfect. So. And now of the wrist, can you hold your wrist out like that? I'm gonna push down, push against my hand. All right, opposite. Now your fingers, I'm gonna push against my hand. and try to stop me from putting your fingers together. Perfect. Okay, patient has 5 out of 5 muscle strength of all upper extremity muscles. All right, can you, actually, can you lean back for me? All right, so can you raise your leg up a bit? So I'm just gonna try to push down, resist. Okay, resist. All right, on the other side, so resist and resist. And I'm gonna just put my hands here. Can you try to bring your legs together? All right, perfect. And now the knees, can you again resist against my hand? Okay. All right, perfect. And then the feet, resist against my hand. Okay, perfect. So patient has 5 out of 5 muscle strength of all the lower extremities. So now for the sensory exam. So and while we're here, we're going to test for cranial nerve number 5. So I'm gonna want you to close your eyes, and can you tell me every time you feel something, okay? Okay, so that was the sensory part of cranial nerve 5. Let me just put on the pair of gloves. Okay, so now we're going to assess for the motor part of cranial nerve 5. So can you clench down really tight for me? Or bite down really tight? Okay, so the temporal muscle, masseter muscle, the muscles are contracted, so cranial nerve 5 is intact. Okay, so now I'm going to touch various parts of your body with various objects. Tell me what sensation you feel and where. So can you close your eyes? Okay, so first,
shock abdominal pain in the left arm, pain in the right arm, pain in the left leg, pain in the right leg, soft like in the left forearm, light in the right forearm, light in the right leg, left leg and a light touch. Dull in the left forearm, dull in the right leg, dull in the left leg, dull in the right forearm. Vibration in the left forearm, vibration in the right forearm, vibration in the left leg, vibration in the right leg.
Okay, and just keep your eyes closed. Can you stick your hands out for me? Now we're going to test for stereokinesis. I'm going to place something in your palm. Just tell me what exactly you feel.
A coin.
Okay.
Okay.
All right, perfect. All right, so you can open your eyes. All right, so now we are going to test for balance and coordination. So I'm going to have you come up. Okay, so can you walk for me, but heel to toe in a straight line? Okay, you can come back. When you're coming back, can you walk on your toes? Okay, and I want you to walk back that way again, but walk on your heels. Okay, perfect. So you could come back. So gait was steady. There was no loss of balance. So you can actually just stand here for me. So can you just close your eyes, put your feet together, stand arms to your side, and just stand like this. So we would monitor for a few seconds, and this is the Romberg test. Okay, there's no swing or loss of balance, so this is a normal or negative or normal Romberg test. Okay, you can have a seat for me. Okay, so I am going to hold up my finger here. I want you to touch my finger, then your nose, okay, as fast as you can. Okay, perfect. So good coordination, and can you lay back for me? We might as well take off your sneakers. I'm gonna leave them off. Oh. And I will need your socks off too. Next.
Okay.
Okay.
All done.
Perfect. All right. So, okay. So now I'm going to want you to, can you take your heel, put it to your knee, and then run it down your shin? Okay, do the same on the other side. Okay, perfect. So that was good. And then lastly, we are going to test for your reflexes. So while you're laying down, let's just go ahead and do the plantar Babinski test. All right, I'm just gonna put this on your feet. Okay, so the toes curled, which is normal. If the toes fanned out, that would have been a positive Babinski test. So you can sit up for me. We're going to just test the deep tendon reflexes. So first the bicep. Okay, so the reflex for the biceps is 2 out of 2. Now we're going to check triceps. Okay, so that's 2 out of 2. Now the brachioradialis. Okay. Okay, so the reflex is 2 out of 2 as well. Now the quadriceps patellar. All right, so I'm going to relax them. All right. Okay, so that was 2 out of 2. And lastly, the Achilles ankle. Okay, so that was 2 out of 2. So all reflexes were a grade 2, which is all normal. So this actually concludes our exam. So I'm gonna step out, you can get dressed. Thank you.